Melbourne, age 16.
I. Conjunctiva. Inspect the patient's conjunctiva for paler anemia. Sclera. Inspect the sclera for jaundice. Inspect the patient's mouth for any kind of vitamin B12 deficiency anemia. Koilanikia, it's also called a spoon nail anemia. It refers to abnormal thin nails. Polar erythemia, a rare condition where palms of both hands become reddish. Finger clubbing, ask the patient to place the nails of their index fingers back to back. Asteresis, it's also called as flapping tremor. It's an inability to maintain a position which is demonstrated by jerking movement. Neck. Palpate the lymph node for any kind of enlargements. Inspection. First observe the general appearance of the patient lying quietly. Skin pigment, hair, spider navy. It's a chronic liver disease. Painful gynecomastic. Increase in size of breast in male due to the increased production of estrogen. Umbilicus. Observe its contour and location and any kind of inflammation. Auscultation. Listen for broods. Aortic brood. Auscultate 1 to 2 centimeters superior to the umbilicus. A brood here may be associated with an abdominal aortic aneurysm. Renal brood. Auscultate 1 to 2 centimeters superior to the umbilicus and slightly lateral to the midline on each side. A brood in this location may be associated with renal artery stenosis. Then assess for bowel sounds. Auscultate over at least two positions on the abdomen to assess bowel sound like normal bowel sound, thinking bowel sound, and absent bowel sound. Palpation. Lightly palpate each of the 9 abdominal regions, assessing for clinical signs suggestive of gastrointestinal pathology like tenderness, rebound tenderness, guarding, Rove's sign, and masses. Deep palpation. Palpate each of the 9 abdominal regions again, this time applying greater pressure to identify any deeper masses. Warn the patient this may feel uncomfortable and ask them to let you know if they want you to stop. You should also carefully monitor the patient's face for evidence of discomfort. Palpation. Palpate the liver. Begin palpation of the right iliac fossa starting at the edge of the superior iliac spine using the flat edge of your hand. Ask the patient to take a deep breath and as they begin to do this, palpate the abdomen. Feel for any step as the liver edge passes below your hand during inspiration. Palpation of the spleen. Ask the patients to take a deep breath and as they begin to do this, palpate the abdomen with your fingers aligned with the left costal margin. Feel for a step as the splenic edge passes below your hand during inspiration. Then ballot the kidneys. Place your left hand behind the patient's back below the ribs and underneath the rib flank. Then place your right hand on the anterior abdominal wall just below the right costal margin of the right. Push your fingers together, pressing upward with your left hand and downwards with your right hand. Ask the patient to take deep breath and as they do, feel the lower pole of the kidney moving down between your fingers. Percussion. Percuss the liver. Percuss upwards 1 to 2 centimeters at the time from the right iliac fossa towards the right costal margin until the percussion note changes from resonant to dull, indicating the location of the lower liver border. Continue the percussion upwards 1 to 2 centimeters at the time until the percussion note changes from dull to resonant, indicating the location of the upper liver border. Percuss the spleen. Percuss upwards 1 to 2 centimeters at a time the right iliac fossa towards the left coastal margin until the percussion note changes from resonant to dull, indicating the location of the spleen. In the absence of splenomegaly, the spleen sound should not be identified using percussion. As a shifting dullness, percuss from the umbilical region to the patient's left flank. If dullness is noted, this may suggest the presence of acidic fluid in the flank. Whilst keeping your fingers over the area at which the percussion note became dull, ask the patient to roll onto their side. Keep the patient on their right side for 20 to 30 seconds and then repeat percussion over the same area. If acid is present, the area that was previously dull should now be resonant. Fluid wave or fluid thrill test. It is a test for finding the free fluid in the abdominal cavity.